A new study shows women who use hair straightening products are at a significantly higher risk of developing uterine cancer. The study, published in the Journal of the National Cancer Institute, compared rates between women who never used hair straighteners and those who frequently used the products. More than 4% of women in the frequent users group develop uterine cancer by the age of 70. That's more than double the rate in the control group. We should note the study showed a correlation between hair straighteners and cancer, but did not establish the products cause cancer. Okay, if that confused you a little bit, for more on this, I'm joined by Dr. Heather Irobunda. She's an obstetrician-gynecologist at NYC Health and Hospitals. Doctor, it's a little confusing, so help us understand what's the connection here between the use of hair straightener and uterine cancer.
So it's believed that some of the different chemicals that are in these chemical straighteners may be endocrine disruptors, so that's hormone disruptors.
Okay.
And essentially, we feel like that interacts with cells in different tissue types, like in the case of uterine cancer in the uterus. And so we think in different parts of the uterus, it can cause people to be more likely to have cancer.
How frequent is uterine cancer just in general, and how difficult is it to treat?
So uterine cancer, there's different types. And so there's endometrial cancer, which is the lining of the uterus. And then there's like sarcomas and things like that that are in the body of the uterus. And so they're not very common cancers to have. However, especially in the cases of the sarcomas, they can be really deadly.
Okay. So might there be other reasons for these increases in uterine cancer that are other culprits outside of this question of hair straightening?
Sure. So sometimes people have predisposing conditions, like they may have something like polycystic ovarian syndrome, which is actually fairly common, where they may end up having higher rates of certain hormones floating around in their bodies, like estrogen, which can cause them to have a higher rate of things like endometrial cancer. And then people who have fibroids, although it's not very common for them to get a sarcoma, it's more common than people without.
So how do we straighten this out? What are the next steps? Because there are obviously a lot of women, Black and Latino women, who are receiving this news with alarm. What's your advice? Let's do this. What's your advice for them at this moment, given what's been, and then let's talk about after that, let's talk about what can be done to kind of answer these questions.
So it's kind of hard because Black and Latino women tend to use these straighteners because of the view of what our hair looks like without the straighteners. And so, unfortunately, there has been a push to have us straighten our hair to look more professional because in our natural state, sometimes people feel like it's unkempt. However, there are pushes now trying to fix that. So I think that's helpful in us using less of those straighteners and then decreasing our risk of having any sort of cancer that comes as a result of that.
Right. So it's essentially a cultural change.
Yes.
With a possible medical result.
Right.
Now, as a question of how to get to the root of uterine cancer, whatever the result or cause, what's the next steps there, do you think?
Oh, we need more research. Unfortunately, research in women's health is actually pretty much lower than all other types of healthcare. And so what we see is that we don't have as many studies as other parts of medicine. So if we can increase the funding and research in things like uterine cancer, things like fibroids and such, I think that would help us improve outcomes for people.
And one thing I was confused about is whether the research was showing that Black women are more affected by this because they're using hair straighteners, or because Black women are seeing greater incidence of uterine cancer for some other reason that we don't know.
So it seems like here in this particular study, it's because Black women are using more straighteners because of the cultural difference in terms of how our hair is. But there seems to be just higher rates of cancer or progression to cancer, like that's more challenging to treat because of disparities in getting health care for Black women.
Right. So again, cultural and societal,
right,
not necessarily medical.
Right.
Dr. Heather Irobunda, thank you so much for being with us.
Yes, thank you.